Digestive issues are something many of us can relate to, at least some of the time. They're unpleasant and we don't often talk about our symptoms due to fear and, let's be honest, embarrassment. But what if that stomach ache isn't just a stomach ache, but an underlying yet treatable condition known as EPI? Joining us today is Dr. Phil Hart to talk about why it's important for people to speak candidly with their healthcare professionals about their gastrointestinal issues and why digestive health should be a priority for everyone. Doctor, thanks so much for being with us.
Hi, Tina. Thanks for having us.
Well, let's talk about those gastrointestinal issues, or GI. What are maybe some of the common symptoms or things that people are dealing with?
Well, GI symptoms are incredibly common, and it's estimated that somewhere between 60 and 70 million people in the United States suffer from some type of GI symptom. And there's a wide range of symptoms, which include things like abdominal bloating, gas, or change in the stool patterns.
And so I did say at the beginning maybe why people don't really talk to their healthcare professionals. I talked a little bit about embarrassment, or we just think it's like another thing. Is that maybe why we don't think it's important to say something to our doctors?
There are probably a variety of reasons. We recently conducted a survey called EPI Uncovered that was supported by the American Gastroenterological Association. And one of the surprising things that we learned from this study is that on average, patients wait 4 years to discuss these symptoms with their healthcare provider. Of those patients that had a difficult time discussing their symptoms, you're right, embarrassment was the most commonly cited factor in about 60% of patients. But other things may just be that patients are hopeful that the symptoms will be self-limited and pass away on their own.
Well, we need to get past it because there's a bigger benefit to talking about it. And I know we're talking about EPI today, but kind of dive a little bit deeper into that and tell me what that is.
Sure. EPI stands for exocrine pancreatic insufficiency. And this is the situation where the pancreas either doesn't make or doesn't release enough of the proper enzymes or chemicals to help us digest the food that we eat. And when this happens, it can produce a variety of symptoms. In its severe forms, these symptoms would be things like greasy stools and unexplained weight loss. But in milder cases of EPI, these could be symptoms like abdominal bloating or gas. And that's one of the things that can make identifying EPI so challenging, is that these mild symptoms overlap with other common GI conditions.
And so, like you said, it is kind of hard to diagnose. So the more we talk about it, the more we explain our symptoms, the better we are to get a good diagnosis. But is there something we can do at the beginning, maybe proactively, to kind of keep us from experiencing any of these issues?
Well, there's not a panacea in this situation in terms of something that a person can do or to avoid to prevent any of these symptoms from happening. But rather, we do want to encourage patients to have a proactive role in this and discussing their symptoms with their healthcare providers to understand whether or not the symptoms that they're having may be simply related to food, or if it's something more serious and potentially treatable, such as EPI.
Again, it could be something as simple as just a slight lifestyle change in what you're eating. But if we want to get some more information on EPI or just our digestive health in general, where can we go online?
Sure. Online resources that would be helpful would be identifyepi.com as well as gastro.org.
See, we're getting over the embarrassment, doctor. We're putting it out in the forefront. We're talking about it and saying, have that conversation with your doctor on your next visit. It's definitely worth that conversation. Thank you so much for joining us.
Okay, great. Thanks, Tina.
Don't go anywhere. The Morning Blend. We'll be right back.